This is AM 600 KOGO, San Diego's news and talk station. Hi there. It's LaDona, live for a few more minutes, and we have an opportunity now to talk to Dr. Wayne Iverson. He's with the Association of American Physicians and Surgeons, the California State Chapter. He's the coordinator, as a matter of fact. And in Poway tomorrow night on the campus of Scripps Memorial Hospital, they're going to show you a movie called Sick and Sicker. This is a free screening, so there is no reason not to go check this out. Let's get Dr. Iverson on here on AM 600 KOGO. Hi, Doctor.
Well, hi, LaDona. How you doing?
Well, I'm doing fine. Now, it looks like this is at Poinsettia Senior Mobile Home Parks Rec Center instead?
It is, and the showing that we had at Scripps was last month.
That's right.
So this is out in Poway at the Poinsettia Mobile Park Center.
Okay.
And it's on Edgemore Street in Poway.
Now, we have a link to your website on our website at KOGO.com, and I know that prior to and following the movie, you guys are going to do an informal discussion about Obamacare. And if you would, just tell us a little bit about what Sick and Sicker is about.
Oh, okay. This movie is about the Canadian healthcare system, which is a government-controlled, single-payer healthcare system, and it's the type of healthcare that the Canadians have been under for a period of time. And what this shows is it shows what happens when the government becomes your doctor. And it's very revealing. The producer is Logan Darrow Clements, who is a very talented producer. And what he did is he went through and he talked to a number of people, including doctors, patients, journalists, a healthcare minister, a member of parliament, even a doctor that went on a hunger strike, and asked them about the healthcare system in Canada. And what he does is he shows what healthcare is like up there, and from that we can get a real good idea of what Obamacare is going to be like in the United States if it ever got going in all of the measures that they had in mind to put forward.
What are the things that some people who are watching this movie, or probably most people, are going to find the most surprising? Because, when you talk about Canadian medical care, that's held up as some sort of standard that we all need to aspire to. Now, I have a friend in Canada who says, sure, basic medical care, not, it's kind of cool. You call the doctor, you go in, you see the doctor. When it starts to get complicated, though, is when it starts to get really complicated for you and you start looking at serious delays in treatment.
That's exactly true. And, it's like if you have health insurance that doesn't perform the way it's supposed to, if you don't use it, it's fine. But the thing is that's not what health insurance is all about. You want health insurance to be there when you're sick, especially when you're sick and have a complicated illness, or if someone's in a lot of pain or a family member's in pain. You want that person treated properly, thoroughly, and right away. And unfortunately, I think what this film does is it shows some of the delays that occur, and I don't think the general public is really aware of it. And I don't think the general public is aware of it because the myth that's been propagated in this country has all been to support Obamacare. And what they do is they take a look at aspects of it and really don't give you the full picture. So I think what this movie does is it goes into a real good explanation of what's going on up there.
Again, this is Dr. Wayne Iverson. He is a physician at Scripps La Jolla. He is also the chapter coordinator, the California chapter coordinator of the Association of American Physicians and Surgeons, talking about a movie that they're showing for free tomorrow called Sick and Sicker, What Happens When the Government Becomes Your Doctor. What were some of the most stunning things that the producer, Logan Darrow Clements, found out about that system in Canada?
Well, the thing is I think it's new information for everybody that sees it. I've been very aware of the difficulties they had, but what the movie really brings to light is that there's certain medical conditions that seem to be delayed over other kinds of conditions. And for example, people who are under cancer treatment. Cancer treatment is a very complicated process. It requires a lot of diagnostic evaluation. It requires very expensive medications. And there's a number of instances where the producer showed actual cases where people didn't get the diagnoses and treatments and studies in time, and then what ended up happening is the cancer condition advanced and became more problems for the person, whereas if there was earlier diagnosis, earlier intervention, there would have been a much better outcome. That's one example. Another example is that in trying to save money, rather than using the best and most expensive drugs right off the bat, what they would do in some of these cases is they would use medicines that weren't quite as good, and then have the person fail treatment before they went to these other medications, which is not the way we do it in the United States.
I think that most people, and myself included, know that Obamacare is going to be complicated, and when they say there are not going to be death panels, that's an absolute lie. There is a lot of stuff buried in this legislation that is going to just scare the hell out of people when they start to become aware of it.
Well, you're right, LaDona, and what the problem is in the stimulus bill, there was over $1 billion set aside for what's called cost-effectiveness research. And basically what this is it's a method of determining how a person should receive medical treatment given their age. And so, for example, a lot of healthcare problems occur in the later years of life, say 75 and over. And what this cost-effectiveness does is it weighs the amount of years that a person's expected to live versus how much it costs to take care of that individual, and then it tries to decide if it's really cost-effective to give that person treatment. The problem is that after the age of 75, and this is not figured into that equation, but a personal physician like myself would know this, after the age of 75, it's no longer chronologic age, it's physiologic age. And there's a lot of people over 75 that are physiologically a lot younger than that, and they should get the treatments that they need. And if you apply cost-effective research and penny pinching, these people aren't going to get the care that they really need. So that's the problem with Obamacare, and so this movie just points out in Canada that they're already looking at it, and that means.
And, there is no such thing as free health care, and that's the thing that I think most people don't quite understand, at least the people who feel they're going to benefit the most from Obamacare, is somebody always has to pay for it, whether it's you or your mom or your dad or somebody's paying the taxes to pay for this, because there ain't no such thing as a free lunch.
Well, yeah, that's exactly true. And with Obamacare, this has been multiplied by what happened several months ago when McDonald's sent a letter to or communicated with the White House that they were going to opt out of paying Obamacare, and they ended up getting a waiver. They had their choice of covering their employees or not, and they got a waiver from Obamacare. And then what happened is 700 other large corporations in the United States followed suit. So what that means is the rest of us in the United States, small, medium, and other large businesses, end up paying the bill that these other 700 large corporations end up opting out of. And that seems to be the problem not only with Obamacare, but the whole administration. If you take a look at a lot of what's gone on ever since President Obama took office, they have all of these laws, very expensive. It's a real burden on the taxpayers. And then certain friends of the president, like the unions, end up getting waivers for a variety of things, and then the rest of the general public ends up footing the bill. It's just not fair. Sick and Sicker, When the Government Becomes Your Doctor. It's a film that is playing tonight. It is over at the Poinsettia Senior Mobile Home Park, and it's their rec center. Actually, it's Wednesday night, tomorrow night. Oh, I'm sorry. I for some reason, I think it's Wednesday, but it's not. It's tomorrow night, and what you need to do is RSVP. What we did is we put a link to your website on our website at KOGO.com, keyword LaDona, so if anybody wants to see it, they can RSVP directly to you. Thanks a lot, LaDona. All right, have a great day. Okay, that's bye. Dr. Wayne Iverson here on AM 600 KOGO, San Diego's news and talk station. Again, that is tomorrow night in Poway. Go see this movie.